Excited to talk this evening on amino acid precursor therapy. There's a lot of material to cover. I'm going to try to go through a PowerPoint presentation, and hopefully we'll have some time for questions. Okay, my name is Dr. James Greenblatt. I'm a board-certified child and adult psychiatrist. I've been practicing psychiatry for over 20 years, and for most of that, refer to my practice and my style as an integrative psychiatrist, utilizing both nutrition, biomedical, and pharmacological interventions when necessary. In terms of disclosures, as of the last few months, I'm a consultant for Great Plains Laboratory, who's sponsoring this webinar. Pure Encapsulations is a supplement company, and I'll be talking about supplements we've developed. And I've written 2 books, one on depression and anorexia. The amino acid precursor therapy for me is one of the more powerful tools that I have as a psychiatrist, because what I believe I'll share with you tonight is we can help patients get off this polypharmacy highway. The psychopharmacology for mental illness is both confusing, it is based on symptomatic relief, and oftentimes the relief is minimal. And part of the benefits of amino acid therapy is both to replace medications, and more importantly, we can talk about helping patients getting off antidepressant medication. Our treatment of depression has really been staggered. This is a study that was not sponsored by any pharmaceutical company. It was a very well done, it's called the STAR-D study, where over 2,000 patients, it was shown that more than 2/3 had unresolved symptoms. And these were patients that had reported improvement and were considered successful treatments for depression, 12 weeks of antidepressant treatment. So you see that 2/3 of patients still had residual treatment, meaning our current model for the treatment of depression is limited. And our current model is also flawed because for many years the pharmaceutical companies withheld all of the negative studies. So based on studies that were published, it showed a 94% benefit for the antidepressants. The actual number is closer to 50% because these studies that did not show a benefit were not published. So the conclusion, about half the antidepressant trials failed to show any benefit that exceeded that of placebo. And that is very frightening based on the number of patients taking antidepressants as well as the cost to society and the disability that depression is. Depression is ranked as the 2nd leading cause of disability worldwide, and it's estimated by 2030 it will be the #1 cause of disability throughout the entire world. So we need to do a better job, and I believe amino acid precursor therapy is one of the more powerful tools that I have. And the most important piece to understand when we talk about integrative medicine for mental health is the concept of individuality. And our current model for treating a mental illness is this symptom-based diagnosis and treatment based on a list of symptoms in the DSM-4. The new DSM-5 will be coming out in May. It's a bigger book of a list of symptoms. There's no concept of what is causing the underlying problem. And I believe that an integrative approach to psychiatry is understanding these 3 systems, the nervous system, the endocrine system, and the immune system, and how they both interact with each other and affect brain and cognitive function. We've talked before on inflammation and how inflammation affects brain function and decreases serotonin. It's quite clear how hormones, thyroid, sex hormones, estrogen, cortisol affects mood and cognitive function. And tonight we're going to talk a little bit about neurotransmitters and particularly the synthesis of neurotransmitters with amino acids. Wherever we talk about mental health, we need to understand how profound an impact stress has. Even though we think of stress as a psychological variable, it has profound physiological implications for all these interconnecting systems. I believe, what's often forgotten is that the stress response is really based on our perception of an event, a thought, or emotion. And it is our unique neurotransmitter response that modulates that stress response. And it's different for everyone. But it's that cycle, whether it's early on to later on in childhood or adulthood, that is a major factor in the etiology of major psychiatric illnesses, depression, and anxiety. We talk about all psychotropic medications. We're talking about drugs that manipulate neurotransmitters in the brain. For years, we thought it was a neurotransmitter deficiency. That's never been shown or proven. But it's pretty clear that there's neurotransmitter dysfunction. Something is not working optimally in the brain, and the neurotransmitters are the communication molecules for all of brain function. Each of these 5 areas could be a discussion amongst itself: the genetic vulnerability to neurotransmitter function, receptor function, stress, inflammation, neurotoxins. And what we're going to focus on today is diet, and again, amino acid precursors. And I'm going to use an example of a patient that I've seen a number of years ago. If you went to the conference in Santa Fe, I talked about MARSHA, who's a 36-year-old female who had been in therapy, stressful childhood, but has been very productive, very healthy until she started having symptoms of fatigue and depression with some insomnia. She went to a primary care physician, had blood work, CBC, thyroid tests, and the primary care doctor said there was nothing wrong, but MARSHA felt terrible and increasingly depressed. And a follow-up visit to a primary care doctor, the antidepressant Lexapro was prescribed without any benefit, and then weeks later, Abilify was added, an antipsychotic that's approved for the augmentation of the antidepressants, and because there was poor sleep, Ativan. So before MARSHA was referred to a psychiatrist, she was on 3 psychotropic medications, not feeling any better, and referred to a psychiatrist. And what's common in my field is individuals not stopping a medication that might not be helpful, but just adding a different medication. So the theory here was Lexapro increases serotonin, so we're adding Wellbutrin, an antidepressant that increases dopamine and norepinephrine. Again, a couple of months into treatment, not any better. Lamictal, a mood stabilizer, was added, and MARSHA still felt pretty miserable. And her words to me when I first saw her was, "I felt worse." So the polypharmacy psychopharm approach based on symptoms failed MARSHA terribly. And I did routine blood work, including B12 levels, more iron levels, thyroid, hormones, celiac disease. Nothing was significant except for looking at plasma levels of amino acids. So if you see here at the top of the amino acid test, all the essential amino acids were dramatically low. And what we'll talk about is how important these amino acids are for the development and synthesis of neurotransmitters in the brain. Nobody with low levels of the essential amino acids are going to be able to make adequate protein, and certainly very important proteins in the brain. What is interesting and important is MARSHA was essentially eating extremely healthy foods. This is supposed to be the salmon flown in from Alaska, so wild salmon, brown rice, and avocados. So she was doing everything that you and I would recommend as a healthy diet, but she still had low levels of amino acids. Why? Well, the simple reason is the lack of digestion and absorption. And I use MARSHA as an example because within 4 weeks, the only intervention was giving her digestive enzymes with hydrochloric acid and a custom amino acid formula just based on the free-form amino acids. This is very different than protein powders, whether it's whey, soy, or pea protein. You still need to break those proteins down to the individual amino acids. And MARSHA was not able to do that. 2 weeks she felt better, and 4 weeks back to herself. So what I want to share with you first is how critical digestion and absorption is to the synthesis of neurotransmitters in the brain. There are over 250 neurotransmitters. We talked about the major ones, dopamine, serotonin, and norepinephrine. And if you see here in this schematic diagram, L-tryptophan is the protein, is the amino acid from protein. And it goes through the synthesis of serotonin, which then goes on to make melatonin. And in red, you're going to see the important cofactors, folate, B6, and zinc. And what we're going to talk about is how adequate precursors as well as cofactors can enhance the synthesis of these neurotransmitters. And for dopamine, we have phenylalanine, it's essential amino acid, goes on for tyrosine to make dopamine. What I'm not going to have time to talk about is the role of copper, and excess copper creates a very significant psychiatric syndrome with aggression, irritability that is related to the enhanced synthesis of norepinephrine. And again, for MARSHA, she had low levels of phenylalanine, tyrosine, and L-tryptophan. She was unable to make these neurotransmitters. So the first point is, regardless of diet, dietary history is not adequate to assess for amino acid because she did not have adequate acids. We need the hydrochloric acid in the stomach, which causes the cascade of digesting, starting with pepsin, where the amino acids are broken down. Oftentimes, people take digestive enzymes and think it's helping with digestion, but frequently, particularly in the health food stores, the digestive enzymes are lacking hydrochloric acid. You need acid to break down protein for the synthesis of these neurotransmitters. Why are amino acids low? Well, for some patients and many of our adolescents, it's just inadequate protein intake. Our vegan adolescents are pretty much eating pasta and maybe some lettuce. Lack of hydrochloric acid, we talked about, and our obsession in this culture and our GI physicians quite rampant overuse of antacids. We certainly have now found the relationship with multiple lawsuits on these long-acting antacids inhibiting absorption of nutrients, whether we have fractures of the wrist, leg, and spine. I believe the chronic use of antacids has profound psychological implications for the same reasons, malabsorption. A wonderful book by Jonathan Wright, Why Stomach Acid is Good for You. And what's important to understand is that the acid is decreasing as we age, and if you look at this chart, aging is in our 20s. So in our 20s, production of stomach acid decreases pretty dramatically. So as we age, we have greater need for stomach acid. And under stress, our GI system turns off the parasympathetic nervous system, which enhances digestion, for the fight or flight response, where digestion is put on hold as we deal with the fight or flight response. So we know how important stomach acid is, but we also know that by changing the levels of these amino acid precursors, we can change levels of neurotransmitters. And we know if we increase tryptophan in the diet, serotonin is going to be increased. And if we decrease tryptophan in the diet, serotonin will be decreased. We've been doing studies for a number of years called tryptophan depletion studies, and these are mostly done with women and experimental animals. And I'm just not sure who volunteers for these studies, but we can take tryptophan out of the diet and we can induce depressed, irritable states. And there was one study that I talk a lot about where these were healthy, recovered bulimics, and they were on a tryptophan amino acid mixture, and after this mixture there was an increase in eating disorder behavior, and for some in this study published in the Archives of General Psychiatry, it persisted for weeks. So we know that amino acid precursors in the diet affect levels of neurotransmitters. We don't use tryptophan as much, one, because of the mechanism, a feedback mechanism, where you can only absorb so much tryptophan in the diet. We often use 5-HTP as a precursor to serotonin. 5-HTP, there's no feedback mechanism, and it's a direct missile, if you will, with enhanced serotonin synthesis. Oftentimes people ask me about side effects of 5-HTP, and clearly GI symptoms are not uncommon because there are more serotonin receptors in the gut, 80% of the serotonin receptors, so oftentimes people can have some GI distress. But a more dangerous side effect, serotonin syndrome, has never been recorded. I've never seen a case study, even though people are theoretically concerned about 5-HTP causing serotonin syndrome. I've seen it many times with the use of multiple psychotropic medications. So with many medications that increase serotonin, we can get a serious physiological abnormality with too much serotonin in the synapse, with multiple autonomic abnormalities. We have never seen it, and I've not seen it recorded with the use of 5-HTP of tryptophan. So to enhance serotonin, we're looking for mood, stress, it affects eating behavior, and relaxation. And the model that I want to share with you is if we look at the amino acid cofactors, the amino acid precursors, the nutritional cofactors, and also helping to maintain the neurotransmitter in the synapse. And if you look here at this schematic diagram, in the red you'll see the presynaptic neuron, where the synthesis of serotonin, where I shared with you, and then it crosses this space called the synapse, and then it goes to the postsynaptic cell, which you'll see in blue. And what happens when the serotonin receptor hits that serotonin molecule, hits the receptor, it causes the release of inositol. So inositol is a very helpful adjunct treatment for the treatment of depression and anxiety. And essentially, serotonin causes the release of inositol, and that's why inositol is considered the second messenger in the brain. And inositol has been a critical component to help us with the effects, the positive effects of serotonin. You also see that serotonin is degraded by an enzyme called MAO. And this enzyme is the basis for many antidepressants that used to be very common in the market, and some are very helpful. If we inhibit that enzyme from breaking down serotonin, we can get improved mood. So one of the supplements that we've developed is enhancing serotonin. And so what we've done is add the 5-HT precursor with an inositol, with taurine, which also helps maintain serotonin in the synapse, with all those cofactors that are required for the synthesis of this serotonin. So what we have is a nutritional formulation with the precursors to serotonin, all the nutritional cofactors that are required, as well as inositol and taurine. We'll talk more about folate and zinc later on. To enhance dopamine, the goal of dopamine in the brain is for a sense of reward. Animals that have had their dopamine receptors removed essentially die because of lack of motivation to eat. So alertness, cognitive function, mood, reward, and attention. All the psychotropic medications that we use for attention deficit disorder enhance dopamine synthesis in the brain. So again, the same schema we talked about, the amino acid precursors, the nutritional cofactors, as well as trying to minimize the degradation of dopamine in the synapse. And here, what I wanted to share with you is the addition of phytochemicals. Again, sorry about the slide. Because curcumin and quercetin have been shown to have direct monoamine oxidase inhibition. Well-done studies in animals, and there's literally hundreds of studies, not a lot of human studies, but these two phytochemicals help prevent the degradation of dopamine and serotonin in the brain. And then we also have adequate, very good research looking at rhodiola and green tea extract, as well as grapeseed and other polyphenols that prevent the inactivation, the reuptake of these monoamine neurotransmitters. So what you see here in this schema, the Dopa Plus supplement is a nutritional supplement where we both enhance the synthesis of dopamine and prevent dopamine degradation. And here you see the tyrosine, the L-Dopa, as well as the grapeseed extract, green tea, and the nutritional cofactors. Enhancing dopamine has been critical for a number of things, but certainly as an adjunct for depression, also for attention deficit disorder, as well as eating disorders. In the upcoming webinar, we'll be talking about food addiction, binge eating, and the lack of dopamine for patients that have these food addictions. And as we enhance dopamine, we can decrease the addiction to foods. What I want to share with you here is that a number of years ago, we did an EEG study looking at grapeseed extract and green tea in the treatment of ADHD. And what we found is a significant benefit by utilizing these phytochemicals that actually enhance the beta waves, which is the attention brain waves. And we were able to document a number of case studies looking at EEGs before and after these phytochemicals. And these were added into the Dopa Plus. And then the last supplement that we worked on is closer to what is out there in terms of amino acid precursors. And that is a combination of the enhancing the synthesis of serotonin with the synthesis of dopamine and norepinephrine. So here, 5-HTP and phenylalanine is added, as well as the nutritional cofactors, and again, the curcumin and quercetin to prevent breakdown. This I found to be a nutritional supplement I've used for over 10 years with these ingredients that has provided a more balanced approach to the treatment of depression. But what we found is a limited value because for many patients, they needed enhanced dopamine, and that's where the Dopa Plus comes in, and other places, patients with anxiety, or most commonly with OCD, the obsessive thinking, can oftentimes require much more enhanced serotonin synthesis. So what we were able to develop is 3 supplements that provide a broad range of neurotransmitter support with the larger amino acid precursor therapies. The NeuroPure also is very important for a prevention of the development of quinolinic acid, as the immune overactivity stimulates an enzyme called IDO, which causes the decrease in tryptophan and serotonin, and quinolinic acid, which is neurotoxic as it binds to the glutamate receptors, causes destruction of the neurons. So the curcumin, as well as the 5-HTP, prevents the tryptophan from being made into quinolinic acid. So this is a summary of these products, and I can get you a copy of this. What we need to talk about, which is the basis for my practice, is not guessing any longer, but looking at biomedical testing to support our decision making. And in all the integrative therapies that I use, I do believe amino acid therapy is the most helpful, and because it works more quickly. And there are a couple tests that are important to discuss. One is the organic acid, where we can actually look at neurotransmitter metabolites. You can see HVA, the metabolites of dopamine, metabolites of norepinephrine, as well as serotonin listed here, as well as the quinolinic acid, which is the neurotoxic byproduct of this hyperactive immune system. Also, you can see the kinorenic acid, which is a measure of B6 deficiency. So as kinorenic acid is elevated, we look at markers for B6 deficiency. So the organic acid has been a very helpful tool to understand neurotransmitter metabolism markers and to kind of help select which amino acid supplements could be most helpful. These are just some examples of different patients. Not going to have time to go over them, but you can see dramatic differences in elevations of metabolites as well as the neurotoxic quinolinic acid. What is also important to understand is the Clostridia marker HPHPA, and this is also found in the organic acid, and it's critical that we understand, because one would not want to give Dopa Plus or NeuroPure if we have elevations of the HPHPA marker. This has been a very powerful test in its association with multiple psychotropic psychiatric illnesses. We've seen OCD, very severe depression, anxiety, and schizophrenia with elevations of this Clostridia marker. Why? Because it is a metabolite of tyrosine, so it interferes with the metabolism norepinephrine, and so we have this abnormal dopamine norepinephrine synthesis, and we get extreme agitation and oftentimes psychosis. This is a study by Dr. Shaw, published in 2010, with elevations of HPA in patients with schizophrenia and autism. We have seen it across the spectrum of psychiatric illnesses, OCD and depression being the most common in my practice. But what is critical is that if you see here the elevation of HPA on the right, we're going to get this enhanced norepinephrine and epinephrine synthesis with pretty significant elevations in anxiety and or psychosis. So what we have is nice markers for understanding the use of these amino acid precursors. Again, with elevations of HPA, we do not want to use phenylalanine or tyrosine, any dopamine precursors. So the biomedical testing is important. One, as we've talked about, the elevations of HPA. We're going to talk in a minute about orotic acid and elevations of quinolinic acid. So the cofactors are also critical. Somebody could have all the amino acid precursors, but either genetic differences and or nutritional differences in folate, B6, zinc, and magnesium. It will profoundly affect the synthesis of these neurotransmitters. In the past, I've used multiple supplements, and it was very difficult for patients, and that's why we've included them all in these amino acid supplements. So I just talk a minute about folate, and it's a critical to neurotransmitter synthesis. Folate is synthesized to SAMe, and L-methylfolate crosses the blood-brain barrier, and SAMe donates a methyl group for the synthesis of all the major catecholamines. This is a slide from the company DEPLETION, because there's actually a pharmaceutical drug that was developed utilizing high doses of L-methylfolate. And in the American Psychiatric Journal this month, there was another article looking at L-methylfolate to enhance the effect of antidepressant medications. And we know we've come a long way from the entire back cover of the American Journal of Psychiatry was an advertisement for L-methylfolate. So times are changing. The nutritional relationship between neurotransmitter synthesis are being now developed by pharmaceutical companies. There's lots of research on folate and depression. This is just one study from the American Journal of Psychiatry where individuals were treated successfully with Prozac, 40 milligrams a day. But if you see here, the relapse rate for those with low folate was almost 50% compared to those with normal folate, where the relapse rate was 3.2%. So besides the research, let's read this again, it's such a profound statistic. So besides the research over the years that we have that shows that low folate is associated with increased incidence of depression, a poor response to the antidepressant, and as I've just shown you, a higher relapse rate, we now have many studies looking at folate supplementation to enhance the effect of the antidepressants. So L-methylfolate is integrated into these amino acid precursor molecules. We also look at SAMe as a nutritional supplement. So here you see a folate deficiency causes elevation of homocysteine, which causes a decrease in SAMe, lack of efficacy. If we add folate, or SAMI, we can get a decreased homocysteine and enhanced clinical response. And SAMI has been used for the treatment of depression, and this is a study that came out a couple of years ago, Harvard Medical School, American Journal of Psychiatry, where SAMI, 1,600 milligrams, was added to those patients for major depression who had not responded initially, and they continued to receive their antidepressants for the 6-week trial with statistically significant improvement by adding SAMI to the antidepressants. And here's the study that just came out, the American Journal of Psychiatry, looking at L-methylfolate to enhance the effect of the SSRIs. I've also talked a lot about zinc and its critical importance for brain function, for serotonin reuptake, for many of the receptors in the brain have zinc-dependent enzymes. We've shown that low levels of zinc have been correlated with depression, and there are also studies looking at augmentation of antidepressants. This study showed that the daily zinc intake and the serum zinc concentrations of those who were depressed were 2/3 of the healthy patients. I guess I don't have, but there are a number of studies where zinc, one was 25 milligrams, another was 50 milligrams of zinc, was added to antidepressants with an enhanced clinical effect of the antidepressant. One study showed the most significant response for zinc were with those patients that were non-responders. So individuals that had a poor response to antidepressants, adding the 25 milligrams of zinc, they developed a positive response. So a lot of information, but to summarize these supplements and then some things to watch out for is, again, the DOPA+, enhancing dopamine in the brain. We think about attention. We think about alertness. We think about eating, addictions, and cognition. And it's also for mood support. The medications that we look at when we use to enhance dopamine are all the stimulants and medications like Wellbutrin. When we're looking for relaxation, obsessive thinking, also healthy eating behavior and mood support, we're using SEROPlus to enhance serotonin. And then the NeuroPure is the more balanced nutritional approach, where we have the precursors to both 5-HTP and phenyl and dopamine, as well as the curcumin and quercetin to prevent the breakdown of these neurotransmitters in the brain. My first choice for depression is usually to start with NeuroPure. My first choice for anxiety or OCD is SEROPlus. And the first choice for kind of addictive eating behavior as well as attention deficit disorder is the DOPA+. One of the cautions of amino acid supplements or high-protein diets is what we call genetic defects in terms of the synthesis of urea. So the amino acids create ammonia, and that's eliminated through the body through the urea cycle in the liver. If there is a genetic defect, then there's going to be this increase in uric acid. And this is all picked up in the organic acid test. Urea cycle defects or excess ammonia can cause a wide range of neurobehavioral symptoms, and some of them quite severe. Many patients that have some of these genetic defects have just been, over time, avoiding protein and have just felt better. And again, through the organic acid test, we can see elevations of uric acid. The amino acid test, we get elevations of glutamine and alanine, and a blood test we can get that should be an elevation of BUN and elevations of ammonia. So it's just a caution when using amino acid supplements that we should be looking for any genetic urea cycle defects that could cause the accumulation of ammonia and urea. So, you know, in summary, as an integrative clinician, we're looking at many, many factors that might be contributing to the cause of the anxiety or depression, or aggravating the underlying symptoms. And we look at multiple nutritional, biochemical factors, and my practice now is based on the biomedical testing, so I'm not guessing. I'm looking at levels of DHEA, I'm looking at cholesterol levels, and I'm looking for food allergies. Tonight I just discussed one aspect of this integrated approach, how critical amino acid therapy is, because neurotransmitters do control every facet of our physiology, certainly regulate mood, behavior, and optimizing the neurotransmitters can be critical. I have not found neurotransmitter testing particularly helpful in my practice. I have not found it accurate. I look for metabolites as well as any genetic defects. We talked about the importance of digestive enzymes and digestive health. So when we talk about integrative medicine, I'm just going to read the last line to you. It is care that is preventative, predictive, and personalized. 10 patients with depression might have 10 different underlying causes, and that really was the premise for my book on depression, with the mnemonic, the zebra approach, where the mnemonic stood for multiple factors that may contribute to depression. I use the zebra mnemonic because each zebra has a unique stripe pattern, and it's critical that we understand mental illness, certainly depression, as having multiple potential etiologies. These are not deficiencies of Prozac. These are biochemical and/or genetic polymorphism that create neurotransmitter imbalances that can be corrected. A little complicated slide for the chemists in the room, but here you see how these amino acid precursor molecules can be helpful. And the tool, the term that I like now is comprehensive medicine, looking for all the tools in our toolbox. You know, we didn't talk about mind-body medicine, the stress response, relaxation, as well as medications can be needed as an adjunct to the nutritional therapy. And we also mentioned how these nutritional amino acid precursors can be used to help patients taper off their medication. So, you know, in summary, understanding the role of nutrition and health is not alternative medicine, and it is just good integrative care. And it's critical that our patients understand this, and we don't talk about integrative medicine as an alternative. It should be part of what we do. So I try to help my patients, and when we do seminars, to educate clinicians about mental illness being seen as multiple areas in physiology. It's not uncommon that we'll see deficiencies in many vitamins, as well as perhaps elevation of a Clostridium metabolite like HPA that's creating the mental health issues our patients are struggling with. And if we find the causes, then we're able to use words like cures. I was given a seminar, and a lawyer for the company that was sponsoring it would not allow me to use the word cure because they said you can't use the word cure when we talk about mental illness. and I argued for a bit and talked about, well, what if somebody had celiac disease and that was treated and their depression and anxiety got better? What if someone had a B12 deficiency that was treated and their symptoms completely resolved? What if somebody had elevations of HPA was treated and resolved? In my book, that's a cure, and that's the goal that we're trying to understand, to eliminate the symptom-based polypharmacy approach where we never look at the underlying causes. I went through a lot of information, and we'll have time for a few questions. All the products that I mentioned today is available from New Beginnings, and you're welcome to contact them for more information, or you can contact me. The webinar will be available on the Great Plains website for, I believe, a week, and after that on my website that you see above.